wants to know what exactly happens when one is experiencing a heart attack. What are these exact symptoms?
Yeah. So I think the question is little ambiguous. There are two parts when I want to answer this. One is what the pathological process ongoing is the blood vessel is closed off completely, either because of plaque rupture, which leads to occlusion of the lumen, and there is formation of the blood clot, and the flow to the muscles of the heart is stopped. This is the pathological process which is ongoing whenever a heart attack is happening, or rather it leads to heart attack. And symptom wise, a person will start having chest pain. The chest pain can vary in severity from mild, which is negligible, to very crucial, and the patient tosses up with severe pain, and there is a feeling of doom because of that severe pain. The pain can be seen from the jaw up to the umbilicus area, and can radiate in both the arms, both the upper arms. The typical anginal chest pain is retrosternal. It is in the center of the chest, not on the left side or on the right side. So it is the central chest pain. It is difficult to localize. We cannot pinpoint with a finger. This is exactly at this point. It is diffuse, usually difficult to localize. And typical scenario, it gets radiated to the left arm. The pain seems as if it is advancing towards the left arm medial aspect, and it will be aggravated by doing activities by walking or climbing staircase or exertion. So these are the symptoms, and it will be associated with sweating, difficulty to breathe, fatigue, weakness. So these are all the associated symptoms. So this is about the typical symptom of angina. And atypical or angina equivalent in diabetic people or elderly people, where they don't feel the pain but they feel severe breathlessness along with profuse sweating, weakness, they tend to sleep, they become drowsy. So these are all the atypical or angina equivalent symptoms.